Hi, I'm Dr. Harry Schick from High Point Health Solutions, and today we're going to be talking about an introduction to autoimmune conditions. We're going to be dealing with metabolic testing, functional nutrition, and neurology, and tying it all together for you to explain autoimmune conditions. Now let's look at autoimmunity as an overall picture, what the big picture is. What's happening is that part of your immune system isn't working properly. Now, it could go in two ways. It can be hyperfunctioning, means that it's overworking, or hypofunction means that it's underworking, or more likely it's hyper in some areas and hypo in others. But whatever you have, an autoimmune condition is just what it is. All autoimmune conditions have a similarity. The difference is which tissue is being attacked. So, for example, an autoimmune condition of the thyroid, and an autoimmune condition of the joints, and an autoimmune condition of the myelin sheath, as in multiple sclerosis, all have many things in common. The big difference is which area is being targeted. And unfortunately, if you have an autoimmune condition against one tissue, it's unlikely that that is the only place that it is firing. Chances are, whether you have symptoms at this point or not, chances are that it's firing at other areas also. Now, when I get a patient in the office now with a chronic problem, in my mind, I consider that they have an autoimmune problem unless it's proven otherwise. That's how prevalent it is. It's increasing every year, and the general approach of conventional health care, of an immune system which is firing out of control, is to use steroids or some kind of drug which will calm down the immune system. This can, of course, provide relief. And of course, this does not get to the underlying issue as to why it's there in the first place. So in an autoimmune condition, what's happening is that your immune system is mistakenly firing against itself. Now, we know that the immune system is designed beautifully to fire against bacteria and viruses and other what are called pathogens, outside instigators that's to fire at and kill. However, in an autoimmune condition, auto meaning self, it's not just firing at bacteria or viruses, it's actually firing at oneself. It doesn't distinguish between self, our own body tissue, and non-self, let's say bacteria, for example. So, how this happens and what to do about it is the topic we're going to go into. So let's understand a little bit about the physiology of what really goes on in an autoimmune situation. So we keep using the word immune system. Let's look at the immune system. So the immune system has natural barriers, again, to protect from outside pathogens. We have skin, which protects against viruses and bacteria. There's enzymes on the skin to help dissolve these things. If we breathe things in, the lungs have the capability to destroy things, plus we can cough or sneeze things out. Our eyes have a coating over it. All these areas which are exposed have a protective army to keep any of the bad guys out. If we eat something that we shouldn't eat and it gets inside, the stomach acid of our stomach can destroy it. And furthermore, if it gets into the gut flora, deeper into the intestines, there's also immune capability to destroy it. And then in our body we have white blood cells. And those white blood cells are designed, actually the mechanism by which to get rid of the bad guys, the pathogens which get into our system and into the blood. Now, in the immune system, in the white blood cells, we have two parts. Right. So first, I discussed the barriers, and now we're talking about what's in the blood. We have two parts called Th1 and Th2 white blood cells. The Th1 blood cells are kind of like, you can think of it as like the sheriff with a gun going after and firing against bad guys. It sees some bacteria, kills it, sees a virus, kills it, sees parasites, kills it, and that's its job. It's a defense against these things. Now, Th2 side works with the Th1 side, but it's kind of like the detective who looks around to find the bad guys, and it points to them. There's a bad guy, so that the Th1 can kill it. There's a bad guy. It gets it ready to identify bad guys that are coming. And this is the theory on which vaccines the vaccinations are based. that we want to mobilize the Th2 side of the immune system. So the Th1 going out and firing, Th2 looking around to find the bad guys, to let the sheriff or the policeman know where things are. Now we also have Th3 cells, regulatory cells, which work on balancing out the two. We don't want too much on the one side, and we don't want too much on the other. There are also Th17 cells. When the regulatory cells don't work well, the Th17 cells tend to grow and proliferate. So it's like a seesaw. T3, the 3 goes down and 17 goes up. The problem with this is when the 17 are involved with tissue destruction. So we want to make sure the Th3 cells are there doing their job. And then on top of that, we have other cells not even involved in that, which are called natural killer cells, which are also involved in getting rid of pathogens or the bad guys. Now, an autoimmune disease is when, as we said, the body attacks itself. So if you think of it like a seesaw, there's Th1, Th2 have to be in balance, and they have to be firing only at the things they should be firing at. Sometimes what happens, though, is that they get out of balance, and when they get out of balance, they can then fire more easily at yourself, at one's own tissue. So the Th1, Th2 have to stay within the proper realm where they're supposed to be, and not be overfiring or underfiring. But however, it doesn't always work that way. So what would trigger your immune system to not do what it's supposed to do? What would knock it out of sync? Well, number one is what's called dysregulation. Your immune system can be out of balance because of stressors, chronic inflammation from poor diet. If your blood sugar is off, either too high or too low, hyperglycemia or hypoglycemia will cause a problem. If your adrenal glands are overly stressed, that will affect your immune system. Any kind of hormonal imbalances. Many times we see women with estrogen to progesterone imbalances, which affects their immune system. Men with low testosterone. There can be neurological imbalances, which we're going to talk about more later. Pregnancy, again, works along with the hormonal imbalances. Many times when I'll ask a woman when it all started, they'll often relate it to when they got pregnant or when they gave birth, because that can act as a trigger. And low vitamin D, because vitamin D works to modulate or balance out that part of the immune system. It can also be due to an active antigen, a chronic infection, bacteria, viruses, a herpes infection or Epstein-Barr, different kinds of bacterial. Lyme's disease is very common. You can have some kind of infection in the gut. A food sensitivity. Sometimes foods will act on the body just like a bacteria or a virus will. And it's more than just having a sensitivity like a runny nose. It actually triggers an autoimmune reaction. That can happen from foods. So we're very careful to test to make sure that's not happening. Also environmental toxins. We live in what's now called a toxic soup. All the toxins that are released in the environment. And also something can happen in the gut called leaky gut syndrome. Some people think that if you don't have leaky gut syndrome, you're not going to have an autoimmune problem. Because when you have a leaky gut problem, toxins released through the intestines into the bloodstream. Toxins that within the intestines are normal in that the body knows how to handle them, but when they get into the blood, they're seen as a foreign invader, and the immune system goes wild. So we see that there is an imbalance between the Th1 and Th2 side due to either something inherently going on in the body or due to some kind of pathogen which is not being able to handle and is there chronically. And because of that, the body can then begin firing at itself, causing tissue destruction. Now, if there is an increase of interleukin 17, the chemical 17 that we talked about before, that will trigger what's called the nitric oxide system. Now, nitric oxide, which we'll talk about in a little bit, has a number of different ways it can show up. One of them is quite destructive. And we see on the bottom here that if that gets activated, see, first we have the poor Th3 regulation, which we talked about, Th3 being the balancer between 1 and 2. That'll activate Li17, which activates the inducible nitrous oxide system. And the bottom line for you to realize is that all of these lead to more tissue destruction, some more severe than others. And that's really the issue, is that when in autoimmune disease, you get inflammation and ultimately tissue destruction. And when the body starts destroying its own tissue, it gets on a track and will continue to do that more and more and more, making things worse until something intervenes, which we're going to discuss, to stop that cycle. In the meantime, with all that tissue destruction and inflammation, the general medical approach again is to just try to calm everything down. As if that wasn't enough, here's the scary part. 70 to 80% of your immune system is in your gut. Now, that's something that isn't known to most people, that your intestines, your gut, houses up to 80% of your immune system. So that, what's scary about that? Well, if you have a problem in your gut, which unfortunately the way people eat, most people do, it's going to trigger your immune system. Fire in the gut means fire in the brain. Why is that? If you have gut inflammation, you're going to wind up producing all inflammatory chemicals called cytokines, which leads to a leaky gut problem. Now you've got the destruction in the blood. The blood gets carried to the brain. Now you're supposed to have a barrier in the brain called the blood-brain barrier, which keeps all this out. But when it doesn't keep this out, the autoimmune issue will then lead to brain problems. When that inflammation happens in the brain, it happens in cells called microglial cells. When that happens there, what do you wind up with on top of everything else? Potential distractibility, anxiety, depression, bipolar disorder, some people suicidal, all stemming from this original autoimmune assault. So again, trying to calm everything down is the common option, but is there anything else that can be done? Yes. Number one, and most importantly, we want to remove the autoimmune triggers. We have to find out what is causing your body to continue to fire against itself. So if you have a reaction, for example, to corn. Now don't start running out, so you don't have to stop eating corn, I'm just giving you an example. But if every time you eat corn, it triggers your immune system, then it's going to set into a cascade of autoimmune reaction every bite of corn you have, popcorn or otherwise. So if you don't know this, you're going to continue to eat corn, and you're going to continue to have problems, and you're going to continue to run probably for medication, and things are just going to get worse and worse with inflammation and destruction. But if you get tested to find out on a test that corn is triggering your immune system, would you want to eat corn anymore? Or potato? Or gluten? Or dairy? Whatever it is. I don't think so. So we see that in very common. Also it can be, by the way, it can be a bacteria that hasn't been found, or a virus that hasn't been found. So we have to find out what is causing the triggering of the immune system. And then we support nutritionally the areas need to be supported, and suppress those that need to be suppressed. So we remove the triggers. You're going to hear this a few times. I tell people often that you can kind of picture it as that you've got a gun pointed at you, pointed at maybe your thyroid or at your elbow joint or wherever it is. You've got an immune system pointing at you, but if you don't pull the trigger, it doesn't really matter that it's pointing at you. You may not like the image, but it's not causing any destruction. A loaded gun pointing at you is not a problem unless the trigger is pulled. So we have to look at what's going on in the gut that may be doing that. You can have a little problem in the gut and then unstable blood sugar, and wham, all of a sudden, instead of a little gun, you've got a cannon. Food sensitivities, and as I said before, chronic inflammation. Now, I want to introduce you to some new terms, perhaps new, depends how long you've been looking at this. Something your body makes called glutathione. Glutathione is the most important chemical made by your body to protect it from damage. Glutathione. Now, it's not something that you take as a pill, it's something your body assembles. Although there are ways that we have found now giving it in a cream that is helpful. The other thing I want you to be aware of now is what's called nitric oxide, which I mentioned earlier. So nitric oxide is a chemical made by the body to help one cell communicate with another. It's crucial in reducing inflammation. Wait a minute. If you've been paying attention, didn't I say before there was something on the bottom of the screen about how it created tissue damage? Well, just to complicate things, there's more than one form of nitric oxide, some good, some bad. And we'll get into that. So let's look at the role of glutathione and nitric oxide in autoimmunity. So you have your immune triggers, and those immune triggers create a response that ultimately leads to a decrease in your body's ability to make enough glutathione to protect you. When you have a decrease in glutathione, it activates the INOS, that was the one you saw on the bottom of the screen, the inducible nitric oxide, and that leads back to tissue destruction. So keeping your glutathione levels normal is crucial, and one main way of doing that is by reducing immune triggers. So you need a strategy for keeping your glutathione up, because that will help dampen autoimmune tissue destruction. It will help enhance your immune system in the proper way, helps to modulate Th1 and Th2, and so forth. For nitric oxide, that chemical must be kept in its proper form, not the destructive form, because it is protective also in autoimmunity. You've got the form called NNOS, which is neuroprotective, protects your nervous system. ENOS, which is helpful in terms of blood flow, also helps tissues recover and regenerate. And then there is the bad guy, the INOS, which causes tissue destruction. So we want to make sure that everything we're doing keeps your glutathione levels up and keeps your nitric oxide systems in their proper proportion. So doing that, and then we have to put it all together. And by doing this and removing triggers goes a long way towards our goal. Our goal is getting you feeling better and living the life that you want to live. So intestinal membrane immunity is important. We have to first balance out what's going on in the intestinal membranes to prevent that leaky gut. Remember, with leaky gut, then we'll get antigens which shouldn't be in the blood reaching out into the blood. And that will throw off and overuse our glutathione system, which will increase our nitric oxide system, the inducible, which is bad, which again leads to tissue destruction. And there are ways to do this. We have tests that we use to measure if you have leaky gut or not. And unfortunately, if you have leaky gut, we can be pretty certain you have leaky brain syndrome also. And in terms of doing this, we also work on intestinal inflammation, calming that down. It's a lot more than just giving you a drug. We have to find out what's going on, why it is going on. Autoimmunity is a metabolic problem involving multiple bodily systems. I think you already knew that from watching up till here. Now, let's back up a little bit and talk about it from the big picture perspective. All chronic problems, and an autoimmune problem is a chronic problem, is some combination of a nervous system problem and a blood chemistry problem. Somewhere in there, between those two, that's where the essence of it lies. So let's look briefly at the nervous system. Because you know, your nervous system controls all functions of your body. We can do everything right and balance you out chemically, all the right nutrients, your foods are balanced, but if your nervous system's not working right, you're not going to feel better. This has to be corrected. So your nervous system consists of the brain, your spinal cord, and all the nerves. Your brain is like your central command, and the nerves are the communication cables that go throughout your body. Each nerve cell of your body is dependent on one another to stay alive and healthy, on activation. Now, how do we activate the brain? Well, the body has receptors having to do with gravity. Like just waking up in the morning activates your nervous system because of gravity. When you move your joints, when you walk, when you grab and hold onto something, when you touch things, your touch receptors are stimulated. You have touch receptors on the skin. Watching this video, your eyes are being stimulated, your ears are hearing. A sense of smell, sense of taste, these are all ways of stimulating your nervous system. But touch and gravity are the main ways of doing it. So of all the things that you do, getting up and walking around and moving around is the greatest way to stimulate your body, to stimulate your brain. Now a lot of you have problems with that. Either you don't have right nerve flow into your feet, to your joint receptors, or you have immobility due to inflammation in your lower body, and we're going to talk about that. So you have three parts of the brain. You have the cerebellum and the cerebrum, and underneath you have the brainstem. Okay, going up, brainstem, cerebellum, and the cerebrum. If this is out of balance, what will happen is that your sympathetic nervous system, now let's understand that for a moment. You have two parts to your nervous system. The sympathetic, which is your fight or flight, right, which is the part where you're walking across the street and a car comes at you. That's your sympathetic nervous system, gets you out of the way of the car. And then you have your parasympathetic nervous system, which is the calming part, when you're lying on the beach and enjoying a nice day, or reading a book, whatever it is for you, watching a video that you enjoy. If your sympathetic nervous system is overfiring, and I got bad news for you folks, it probably is if you're living in this society, that will contribute to chronic pain, chronic fatigue, irritable bowel syndrome, urinary infections, fibromyalgia, and so forth. All from an overfiring sympathetic nervous system. You can have symptoms that are like blurred vision, increased sweating, dizziness, heart palpitations, cold hands and feet. These are a result of inflammation in your body, potentially from an autoimmune cause, which affects the brain, which causes an overfiring of the sympathetic nervous system. That's how autoimmunity can create some of these things. When it creates a fatigue in the brain, it can also create fatigue in the cerebellum, which is the lower part of the brain. And here you'll find a loss of balance. You may get dizziness or vertigo, chronic neck and back pain. Again, all triggered initially by autoimmunity. Headaches, clumsiness, difficult with clear thinking, and so forth. The cerebellum fires to the upper brain, which fires down to the brainstem. Now, in upper brain fatigue, and why would you have upper brain fatigue? Inflammation. Why would you have inflammation? Autoimmune problem, which gets through the blood-brain barrier. Depression, anxiety, difficulty reading, difficulty with addition, difficulty remembering names. Okay. Learning difficulties, lack of focus. You can see now why some of the problems you have, which you may not have initially attributed to your autoimmune condition, how they're all tied together. Altered sensation, you may have a tingling or a feeling of coldness on the left leg and not on the right. Changes in handwriting. One of the main things we see when people are getting better is that their handwriting improves. That's a great sign. With upper brain, of course, we get mood changes, body weakness, anger. Now this is a big one, lack of motivation. This is going to be a big problem for you in watching this. Because many people watch this and they're going, this sounds good. Hey, I think this makes sense. Yeah, this is different stuff. And then what do? Nothing. How does that help them? It doesn't. Because lack of motivation is actually one of the issues that we see in autoimmune conditions, particularly when it's affected the brain. So when you're done watching this, you may not feel the motivation that you need. Hopefully you're watching this with somebody who's going to prod you to get you to do what you need to do. But still you have to do it. We have so many people coming in, one spouse almost literally dragging the other one in. Because they, at this point, don't have the motivation. Once they're feeling better, they're plenty motivated like they used to be. But just be aware of that if that's a situation for you. So a fatigue in the upper lobes of the brain will result in a lack of inhibition of that sympathetic nervous system. Your sympathetic, your fight or flight mechanism will just go too far, too much. That will, through a system of overstimulating your midbrain, will release hormones, which further affects your autoimmune condition and can give you a side effect of chronic pain, maybe even fibromyalgia, maybe lack of sleep. Okay, sounds pretty bad. How does this happen? Stress. Unfortunately, that's the big six-letter word. Stress can be chemical, physical, or emotional, but it all causes the brain to fatigue. When your autoimmune condition fires you up and affects the brain, you end up with fewer nerve impulses and nervous system fatigue. So what are we going to do about this? All right? What are we going to do specifically about the neurological component? We use something called brain-based therapy. Now, if up until now you kind of got what I was saying, that's fine. You understand that there's inflammation, It affects the nervous system, it affects the body. I want to talk to you now about some solutions. The reason that we have solutions is because your brain and your nervous system has something called neuroplasticity. It can rewire. And the fact that it can rewire is phenomenal for us, because that's what really gives us hope and gives us the ability to make major changes. When your brain is stimulated, it will and can change. Let me say that again. When your brain is stimulated, you will get changes. Now, what kind of stimulation? Well, it depends on what you need. We are big here in this office at High Point to finding out what you need. Not everybody gets the same thing. Even two people with similar symptoms are going to have different programs. The question is, what do you need? Okay. So, one thing which isn't common with everybody is that the cerebellum and the brain require two things to function properly: fuel, the right amount of sugar, and proper oxygen. The right amount of sugar and proper oxygen are crucial for nervous system firing, crucial for lowering inflammation. And then the brain needs activation. Now, the type of activation may vary, but everybody needs that. And if you've been suffering with an autoimmune condition for any length of time, I can tell you for sure your nervous system is compromised, and we have to find out where that is in order for you to get your optimum health, which is what you're looking for. So I'm just going to highlight one or two therapies just to give you some idea of things that you probably haven't heard of. So I want to show you that even though you may have tried a lot of things before, you haven't tried everything, and that's the good news. There's something called pulsed electromagnetic frequencies. Now, I don't know you. I can't see you through the camera, but I do know something about you. If you have an autoimmune problem and you've had chronic inflammation, the voltage, the electrical charge in your cell is diminished. That's really what aging is, by the way. You know, the cells of our body die and are replaced by new cells. If the voltage in your cell is normal, where it should be, you're going to replace that old cell with a new healthy cell, and you're not going to age. But if over time the voltage in your cell drops, you're not going to have the energy to make a new healthy cell. The cells that you make over time are going to be diminished in terms of capability. And your skin diminished in terms of looks, and muscle diminished in terms of function. So a key thing is, what do we do about the decreased frequency, or the decreased voltage, which relates to frequency, in the cell? That's number one. Number two, when the voltage goes down, two other very bad things happen. The cell loses oxygen, so now you have less oxygen in the cell, and I'm sure you remember from a few moments ago, we talked about how crucial oxygen is in order for nervous system activity. And the cell also becomes acidic. Acidic is a chemical term, meaning how capable that cell will be in order to do its functions. So low voltage leads to a deoxygenated, a low oxygen acidic cell. Not good. How do we change that? Well, you may think for oxygen doing more breathing, but that's not going to work. You need to breathe, but extra breathing won't help. And some people I know, that they find out they're too acidic, they try to eat a lot of alkaline foods. Doesn't work either, for many reasons. Not that alkaline foods are bad, but it doesn't help the internal of the cell. But what we can do is we go right to the source of the matter and we increase the voltage in your cell. Because when the voltage of your cell goes up, oxygen comes in and alkalinity comes in and replaces the acidic condition. Now, we can't do this with electricity, even though most people think of electricity in terms of voltage, because we can't run an electric current into your body strong enough to get inside the cell. It would burn your skin. But we can use electromagnetic frequencies. And this is a picture of a pulsed electromagnetic frequency unit, which is an electromagnet which sends magnetic impulses into the body, which hit the cell. The cell changes them to electric, so magnetic becomes electric, and inside the cell, the voltage goes up, oxygen comes in, the cell becomes alkaline, and the cell can begin to heal. If you think I'm excited about this, you're right. This therapeutic machine has revolutionized what we do in this office. And with chronic conditions and inflammatory conditions, it is unbelievable. And if you haven't seen this or tried this or had one of these units used, you're in for a treat. Now, we also have to get stimulation in the nervous system. Now, for many of you, walking is difficult. So we have something for you also. We have what's called an anti-gravity treadmill. So an anti-gravity treadmill is where a person stands on. You can see it looks like a normal treadmill, except there's a bubble around it. That bubble is a pressurized chamber, so that when you're standing in it and walking, instead of you weighing 200 pounds, your body only experiences you as weighing 40 or 50 pounds. So now you're able to do all your normal walking that you want to do without strain and stress on your joints. So you have a hip problem, knee problem, foot problems. If you have balance problems, you can't fall out of this. We use this with our Parkinson's patients, with all kinds of neurological gait issues, with rehabbing people from injuries, and with people with autoimmune problems where inflammation has affected their gait in any way, either due to their brain or their joints. We use this. Those are two of the big ones. There's many other therapies we use. We use vibration therapy. We use different kinds of balance therapy, auricular therapy. We use special hearing therapy, olfactory smell therapy. How do we decide? We have to test you. What's the problem? What areas have not been working right? What areas are deteriorating? What areas are dying? And because of neuroplasticity, we charge them up and get them working normal, close to normal again. Sometimes we use certain color lenses, eye exercises. We have many, many things that we do. Again, the key is finding the ones that you need and doing those for you. How do we do that? With proper testing. So we've talked about proper testing when it comes to your nervous system, to your neurological system. Now we want to talk about proper testing for the metabolic side, for your chemical side. So many times I've had patients come in here and I ask them if I can see their blood work. They tell me really no need for me to look at it because everything is normal. And they've been told that. Of course, it's a little confusing to be told everything is normal and to still not feel well, but that's what they've been told. So I want to explain something. The word normal is used in a specific way, and I want you to understand this. When you're told that your blood tests, for example, are within a normal range, let me ask you, how did they figure out the normal range? You ever wonder? So I'm going to tell you, the normal range on blood work is calculated based on everybody who has had blood work over the last few years. And they take the average of those people. So have you ever gone to a lab and looked around and seen the other people who are getting blood work done? Would you say it's like the healthiest of society? Of course not. Healthy people do go in for checkups. But the majority of people in any given day going in for blood work are sick, they're on medication, they're not feeling well, they have acute problems, chronic problems. This is who you're being compared with. So the truth is, you're not being told you're normal, you're being told you're average. You're being told that your blood work is as good as the average person who comes in here. Well, that's not really very helpful for you. What you need to do is to be normal for what your body needs, not just to be as good as your neighbor who may not be feeling well. So we use what are called functional lab values, and these are more sensitive to reveal problems. The functional range is over here. It's much more narrow than what's called a normal range. A normal range is very wide, taking into account all the sick people. We work at a functional range, taking into account only what's good for you. So I'll give you an example. Let's look at glucose. We've talked about blood sugar, very important. What about your blood sugar level? Well, a traditional range that would be used by a lab, it would be between 65 and 110. So if you're anywhere in there, you're being told you're normal, nothing to worry about. However, we know that's not true. Really, you need to be between 85 and 100. If you're below 85, let's say 73, you could have what's called hypoglycemia, which means you're not getting enough oxygen to your brain for your body to heal itself. But you're as good as your neighbors, so you're being told you're normal. So when we look at it with blood work, we look at number one, making sure all the tests are done. And unfortunately, many people who bring blood work in have had a very small sampling of what needs to be tested. And secondly, how is it being interpreted? Based on what's normal and good for you, or compared to how everybody else is doing. So, we take it, when you come in, of course, I'm going to sit down with you, take a complete history, and then decide what tests you need so that we can get into and underneath everything that's going on that's making you feel the way you're feeling. That will include blood work. It can include saliva tests. We do saliva tests to measure hormones. It's for most hormones, it's much more valuable to measure through saliva versus blood. We also do genetic testing based on saliva, and there's certain defects such as one called MTHFR, which if you have it, there's certain foods you should never eat and certain things you must do. Somebody with an MTHFR problem is not going to feel well unless that gets handled. How do we know if you have it? Proper testing. We may do a stool test to see if there are yeast or parasites, test for heavy metals, food allergy testing. This is a small sample. I don't know what you need because I haven't met you yet, but when you come in and we talk, then I'll know what you need. Then we can do the testing. Then we go from there. So how many of you have had these tests performed? Probably very few. And how were they interpreted? That's the other side of it. So, with autoimmunity, we're looking at a neurological issue and a metabolic issue, and the complications of those two together. As we begin to figure out what's going on, we begin to put the pieces together, and here's what we wind up with. Getting you back to being as whole a person as we can. And we've seen fantastic things. You can look on the website. You'll see testimonials from people like you with conditions, autoimmune conditions like Raynaud's, arthritis, irritable bowel, all kinds of Hashimoto's, all kinds of autoimmune conditions, which when helped in a proper way can get tremendous relief. I like to think of you like this. If you have an autoimmune problem, you're on fire. And the fire is only going to spread. This fire will not spontaneously put itself out. It will get worse. Now, some parts are still standing, but a lot of it is inflamed. So what's the first thing that needs to happen in this scenario? How about putting the fire out? Finding what's creating the fire. But putting the fire out here is not going to be enough. You can still have a semi-destroyed building. You have to rebuild the building. So those are the two steps we do. How do we put out the fire naturally? How do we get your body to stop refiring itself up? And then what kind of work do we need to do for you to get you to rebuild yourself? Okay, so what's next? You don't want to be on fire. You want to be rebuilt. What do we do? So I'm going to tell you what we do in our office. I'm going to describe to you the first two visits with me. First visit, we do a complete neurological evaluation. Testing, I'm pretty sure, and feel safe to say you've never had done before, because we need to know what is going on with your nervous system. You cannot rebuild a body if the nervous system is not intact. I'm going to review whatever existing labs you've had done. You either bring those in or we'll call for them, or we'll get those. And then I'm going to give you a metabolic assessment form to fill out, which will help me see what's going on with you, a neurotransmitter assessment form, which will target into what's going on with your brain. And I'm going to take all this information along with your history so that I know who you are and what's driving the issues that are driving you. It's a very complex process, and when you leave after that first time, chances are you're not going to remember everything that happened, and you're even less likely to be able to go home and explain it to your significant other who's going to say, okay, what happened there? Well, you're not going to be able to explain it. So we ask, therefore, that you bring that person with you. Number one, they will be able to go over things with you because they'll be watching. And number two, you won't have to try to explain it to them. They'll know what's going on. Now, you come back for visit 2. Between visit 1 and visit 2, I'll be deciding if I'm going to accept your case or not. If I accept your case, it means I feel like I'm going to help you. If I do accept your case, we'll have an overview of the testing, and I will order more testing if it needs to be done. We're going to review the neurological findings from day 1 so that you understand neurologically what's happening. I'm going to go over the treatment plan with you. How do we get from A to that burning house, putting out the fire and rebuilding you? and we're going to review the financial obligations that you're going to have. And again, please bring that significant person with you, or else you're going to be left trying to explain to them even more information from visit 2 than you had in visit 1. So here's what happens on my end. So here is my offer to you. Number one, I only accept 5 new autoimmune compromised patients per month. I love working with people with autoimmune problems. It's very gratifying to see the changes. It's a lot of work, but it's gratifying. However, we do a lot of other things in the office, and we like to make room for other conditions, other situations also. So we accept 5 per month. Now normally the first 2 visits, which I just described to you, are $450. And that's a lot of information for $450. But if you call and make an appointment after watching this, your first 2 visits will be $75. So that's up to you. Remember we talked before about low motivation. If you can motivate yourself, I'm giving you an extra reason to motivate yourself now, financially, to come in and get the information. And it's really no risk in it in one sense, because if I don't feel like I can help you after visit 1, you come in for visit 2, you're getting your $75 back. I'm not keeping any of your money, I'm not taking a penny from you unless I feel like I can help you. Now, speaking of money, let's finish up with that. There's 3 rules, that's my situation, there's 3 rules I have for you. Number 1, you must be willing to make serious life changes. Listen folks, you are the way you are because of what you've been doing and the decisions you've made, and that's fine, except it's not good enough for where you are and for your life. If we're going to do anything together, you have to know I'm not doing it to you, we're doing it together. You have to make serious life changes. You have to take accountability for your health. If you're not willing to do that, if you don't want to do that, if you'd rather stay where you are, then this is not the place for you. And then in terms of finances, insurance and Medicare may pay a small portion of it, they may pay more, I don't know. But we find that the majority of people who come in, if they pay between $200 and $400 a month, can get the care that they need. Every situation is different, but people like to have some kind of a range. Could be more, could be less, so that's yours. I will tell all of this to you at visit 2, so you'll know exactly what your situation is. Now, more important, on a scale of 1 to 10, how serious is your illness to you? I've seen people who seem devastated to me who say that's about a 2 or a 3, even though they have relationship problems, they can't work, they can't get around. But for them, in the way they gauge their life, they're a 2 or a 3. For other people, it would be an 8, 9, or a 10. I'm looking for people who consider the problem an 8, 9, or 10. If it's not important to you, and if it winds up being more important to me than it is to you, then it's not going to work. So ask yourself, how has it affected your relationships? How about your work? Do you have energy? Do you enjoy your life? You know, we only go around once in this body. Are you enjoying it? Are you getting out of it what you can or should be getting out of it? On a scale of 1 to 10, how serious are you in eliminating this illness, this problem? So again, I'm only interested in accepting those people who are truly committed. I want to thank you for your time. Thank you for watching. I look forward to you motivating yourself to give us a call. If you have questions, you can email me. But more important than that, check on the website, our phone number. Give us a call. Remember, tell them that you watched this video and that you want to set up an appointment to come in for your first of 2 visits. I'm Dr. Harry Schick. Thank you so much for listening. I look forward to seeing you.